Premier, we've put similar questions to Dr. Henry and Minister Dix this week, but I think people want to hear from the Premier. In the past month, critical care hospitalizations have gone up 40%. So is the province comfortable easing restrictions while hospitalizations rise simply because a much smaller percentage of people are dying now? And how big of a struggle is it making those decisions? And do you worry that they're the right ones?
Well, thank you for the question. And of course, every day we are faced with very challenging decisions, not just in healthcare, but in a range of areas. I knew that when I signed on for the job. I'm not complaining. I'm just stating the obvious. These are oftentimes extremely difficult decisions to make. I'm in regular contact with Minister Dix, of course, and also regular briefings from Dr. Henry and her team at Public Health. We believe that the vaccination program is in really good place right now. We've been accelerating stages as we've seen more supply come on stream. But the persistent caseload of about 500 to 550 over the past number of weeks is disconcerting. Dr. Henry makes that clear every day she is before you and when she releases information when it's in a press release form. So we grapple with these issues on a daily basis. Minister Dix is confident that the capacity within our acute care system is robust, and over the past 12 months we've learned a lot. The frontline workers, the nurses, the doctors, the care aides, everyone in our acute care system has adapted how they work to make sure that we can continue to keep open and get surgeries done, provide emergency services when they're required, and also convalescent time for those who need it. I'm confident that we're on the right track. It's a very good question, and I appreciate why people would say these hospitalizations are creeping up. But it has been a slow increase, and as we start to vaccinate more, we'll see a reduction in caseloads and hopefully a reduction in hospitalizations as well.
Tanya, do you have a follow-up?
Yeah, along the same lines. I mean, Ontario has declared a third wave the same week that BC announced it's once again allowing small outdoor gatherings, for example. So what do you say to people who don't understand the rationale for us kind of going the opposite direction and lifting measures when, as you've noted twice now, daily case counts haven't budged for weeks and variants are still spreading? Like, is there a concern that we'll see cases rise? You know, what if spring break triggers a spike in transmission before the mass vaccination effort kicks in?
Well, certainly I've tried not to compare British Columbia's results to other jurisdictions in the country. We're all different. It's not just population size. It's not just densities in Toronto versus densities in Vancouver or Victoria. It's also weather. The good people of Eastern Canada are still in the grip of winter coming to spring as we're saying farewell to our daffodils and hello to our tulips. So the respiratory seasons are different across the country. We take that into consideration. We've had a very, very mild flu season. I give full credit to Dr. Henry and Minister Dix for having the largest influenza vaccination program we've ever had, as well as, of course, the physical distancing measures that people have been fastidiously practicing. And I'm grateful for the good sense and the commitment of the people of BC. But we're not in the same place as Ontario, and we know that during the spring break, people are going to want to get outdoors. Why not? And we also know that young people particularly want to be with their peers. And if we can manage that in the reasonable numbers of people who are often together in any event, whether they be school chums or families that are involved in the same extracurricular activities, I think that's good for our mental well-being. It's also good as we come out of the pandemic. Are we concerned about the increase in variants? Absolutely. Again, Dr. Henry is better placed to answer specific questions about that. That's been a deliberate approach by our government to allow the public health officials to speak directly to British Columbians rather than have intermediaries like myself. But I assure you that I fret as much about these numbers as Dr. Henry does and Minister Dix. We are in constant contact, and I look at I wait anxiously for the sheet to arrive for each day's count, just as you and the media and people across BC do. I'm confident that we're in a good place. We are going from scarcity of vaccines to abundance, thank goodness. And we have a very solid plan in place. We're going to be talking about that a little bit more tomorrow. The plan has to be nimble and adaptive, just as our responses to the economic challenges have to be nimble and adaptive.